Alright, so for this video I want us to start understanding some of this finger anatomy and this digitorum anatomy going on over here. Okay, so before we go into that, let's talk about the joints that we're dealing with here. So these right here will be my metacarpals, okay? These are going to be my metacarpals. And over here, distal to my metacarpals are going to be my phalanges, right? Notice that digit 1, the thumb, right, is only going to have 2 phalanges, whereas the rest of digits 2 through 5 are going to have each 3 phalanges, okay? So we're going to name these phalanges distal, middle, and proximal, okay? Distal, the furthest one of all, the most distal, okay? Beautiful. Now, the joint between the metacarpal and this proximal row of phalanges, right, or the proximal phalanx, is going to be known as my metacarpal phalangeal joint, right? Makes sense. Attaches my metacarpals to my phalanges. So that's my MCP joint, okay? MCP joint, metacarpal phalangeal joint. The next one after that, right, is going to be the junction between my proximal phalanx and my middle phalanx. And then the next one after that is going to be the junction between my middle phalanx and my distal phalanx, right? So those are going to be 2 different joints that are connecting one phalanx to another phalanx. So we call those interphalangeal joints, right? But there's 2 of them, at least for digits 2 through 5. There's 2 of them. So we need to distinguish between the more proximal one and the more distal one. So we're going to call this one, the more proximal one, we're going to call it the proximal interphalangeal joint, or the PIP joint, okay? That's going to be that guy right there, all right? Next, we're going to have the other one, the distal interphalangeal joint, DIP joint will be this one. And since the thumb only has 2 phalanges, a proximal and a distal phalanx, we're going to call that just the IP joint, right? The interphalangeal joint. So if I say the interphalangeal joint, you should know that I'm just talking about the thumb, okay? Interphalangeal joint at the thumb. All right, beautiful, straightforward, right? Not a problem. We talked about the carpi muscles in the video about the carpi muscles, right? So we know that those don't have any function whatsoever in terms of moving the digits. They attach at the metacarpals and they will move the wrist. The digitorum muscles, however, will be moving our digits, right? How many of them are there? There's 3. There's Flexor Digitorum Superficialis, Flexor Digitorum Profundus, and then there's Extensor Digitorum Communis, or Extensor Digitorum, okay? Communist does not refer to the governmental system of communism. It refers to community communist, as in all 4 digits being brought together. So the Extensor Digitorum is the 3rd one, okay? Now, question, why is there 2 flexors but only 1 extensor? Why is there 2 flexors but only 1 extensor? Right? Let's think about it. So whenever we're going in our day-to-day processes, right, are we using more power for flexion, or are we using more power for extension? We're using more power for flexion. We're grasping animals, right? So when I go to, grab on this skeleton like this, or I'm carrying a bag or anything that I'm doing, I need more force being produced for flexion than I do for extension, okay? So that's why we have 2 flexors and only 1 extensor, okay? Or that's one way of rationalizing and understanding why that's the case. So Flexor Digitorum Profundus, Flexor Digitorum Superficialis. Now, the distal attachments, right? So they have to move the digits. So in order to move the digits, that means they have to be able to at least cross the metacarpal phalangeal joint. They need to at least cross the metacarpal phalangeal joint, right? That's your knuckle joint. That's this guy right here, right? That's your knuckle joint, okay? So they at least have to cross the metacarpal phalangeal joint in order to get this finger moving, okay? But in addition to that, now, the question is, will they attach to the proximal phalanx? Will it stop there? Will they attach to the middle phalanx? Will it stop there? Or will they attach to the distal phalanx? Well, if I were to stop at the proximal phalanx, that means I can only move my metacarpal phalangeal joint. If I stop at the middle phalanx, that means I can move the metacarpal phalangeal joint, and in addition to that, I can also move my proximal interphalangeal joint. But if I stop at the distal phalanx, that means I can move all three. I can move MCP, PIP, and my DIP, correct? Okay, beautiful. Now, there's two flexors, right? Where are they going to attach? Flexor Digitorum Profundus, okay? Flexor Digitorum Profundus is going to run its way all the way to the distal phalanges of digits 2 through 5, okay? 2 through 5, or in this instance, 5 through 2, okay? Now, that's Flexor Digitorum Profundus in red, right? Profundus. Now, Superficialis, I'm going to put in this nice yellow color over here. Superficialis is not going to run all the way to those distal phalanges. Superficialis is actually going to stop at the middle phalanges, okay? And now, the thing is this. The tendon will be running as one single tendon, but then, as soon as it reaches close to here, it's going to bifurcate or split into two to then allow passageway for the tendon of profundus to go through. Because profundus means deep. Superficialis is not deep, it's superficial, okay? So this tells you the relationship between these two muscles in orientation to each other as they lie in the forearm. The profundus is going to be lying deep to or underneath the superficialis, okay, when we're looking at it from the anterior view. So as the tendon for superficialis runs forward, it needs to allow space for that tendon that's running right underneath it to go the extra distance and cross the distal interphalangeal joint to then reach the distal phalanx, okay? So superficialis tendon is going to bifurcate and attach onto the middle phalanges, right? So what does that tell us? That tells us that for flexion of the distal interphalangeal joints, we only have one muscle that is contributing to that. There's only one muscle contributing to that. For this movement now, there's two muscles contributing to that, right? I have much more power in my proximal interphalangeal joint and my metacarpal phalangeal joints than I do in my distal interphalangeal joints, okay? Now, one more thing I want to leave you guys with is, since we're talking about these digits, I don't want to forget about the thumb, okay? Don't want to forget about the thumb. So the thumb, we have one muscle that's dedicated to flexing the thumb, at least coming from the forearm, right? An extrinsic muscle of the hand in the forearm. It's going to be lying directly lateral to, right next to the Flexor Digitorum Profundus. So if I were dissecting this on a cadaver, right, if I were to move my superficialis muscle out of the way and look at my profundus muscle, if I look directly lateral to that muscle, right, towards the radius, I will see one belly of a muscle that's running to create one tendon that will also go through the carpal tunnel, and this will go and run to the distal phalanx of that thumb, okay? So that is known as my Flexor Pollicis Longus, okay? Flexor Pollicis Longus. And if there's a longus, there's a brevis. The Flexor Pollicis brevis is going to be intrinsic to the hand, part of the thenar eminence, okay? So we have here Flexor Digitorum Profundus going to the distal phalanges, Flexor Digitorum Superficialis bifurcating and stopping at the middle phalanges, and the Flexor Pollicis Longus going to the distal phalanx of the thumb, okay, the pollex. And again, there's this bifurcation of the superficialis tendon, allowing the passageway for the profundus tendon to reach its target. That structure right there, that bifurcation with the tendon crossing underneath it, is known as Camper's chiasm. The space or the chiasm produced by the bifurcation of the superficialis tendon is known as Camper's chiasm. Okay? All these tendons, 1, 2, 3, 4, 5, 6, 7, 8, 9 tendons, are all running through a structure that covers the distal aspect of the forearm, which is known as the carpal tunnel. Also, I should say it includes over the carpal bones as well. Okay? The carpal tunnel. There's going to be 9 tendons and one more structure, very important, that's going to run through that carpal tunnel, right? At least when it's in the carpal tunnel, it's the most superficial one, will be your median nerve. Okay, your median nerve. All right, and these are the forearm digitorum muscles plus the pollicis in a nutshell. All right.